Following a hair transplant, many patients are unsure about what they can and can't do during the recovery period. So to make things easier, we decided to compose a list of the most commonly occurring questions from our patients. Hi, I'm Janos from Hair Palace Hair Clinic, and as a patient coordinator, I've accompanied the treatment of more than 1,500 patients in the past 5 years. So without further ado, let's get right into it. When can I start using my own shampoo? You should wait at least a full month before using your own shampoos that have fragrances, sulfates or other additives that may be harmful to your freshly implanted hairs. However, it also depends on the type of shampoo we are talking about. Caffeinated shampoos such as Altacin may be used after 3 weeks, while anti-dandruff or volumizing shampoos should only be used after week 4. Should I use minoxidil or finasteride? Now this is fully up to you. In the view of our surgeons, it's not absolutely necessary, but it can certainly help in some cases. However, if you decide to use minoxidil, it's crucial that you wait at least a full month before doing so. In case of finasteride, as long as it is the classic oral version of it, you can continue to take it before, during and after the surgery without any interruptions. And it's also important to note that you have to keep taking these medications on a continuous basis to maintain any results. Plus, there is a long list of side effects to be aware of. Check out our video on minoxidil and finasteride to learn more. When can you start training and running? You can start to exercise lightly 3 weeks after the surgery, but you should only do heavy lifting after a full month has passed. The excessive sweating and stress that comes with heavy exercise are extremely harmful to your freshly implanted follicles. So exercising too early may put your end result in jeopardy. When can you start swimming? If you want to go swimming, you should wait at least a month after your hair transplant. Naturally, you will still have to be careful if you are required to put on a swimming cap. And if you prefer the beach over the swimming pool, make sure you protect your scalp from sunburn with lightweight hats or water-based sunscreen. Why is a haircut necessary before the treatment? This is largely for practical reasons. Cutting your hair short allows the surgeon to get a better view of your scalp and carry out the procedure more precisely. While some clinics offer surgery with a partial haircut, this significantly increases the time needed to carry out the procedure. Additionally, having short hair all over makes the aftercare much simpler. So the short answer is that it's much easier and safer to conduct the procedure this way. Do I have to take medication after the surgery? You will have to take antibiotics for the first week after the treatment. This is to reduce the risk of inflammation and infection in both the implanted and the donor areas. You will also be given some painkillers, but whether you take these or not is completely up to you. Some patients have high pain thresholds, while others need medication to ease postoperative discomfort. However, if you feel a small amount of pain in the first few days after the surgery, this should subside within a week after the operation. The implanted area and the donor side may feel irritated and itchy after the surgery. What should I do? During the first week, you cannot touch the scalp, but taking the antibiotics and using the saline spray will help. After the first week, you will have to soak and gently massage your scalp on a daily basis to remove the scabs. This will soothe and improve your scalp, and if needed, it will be okay to apply aloe vera to your donor area. Why is the treatment plan only for one area if several areas are affected? There can be several reasons for your doctor recommending a certain hair distribution. For example, focusing all the hairs on one single area might be needed to achieve a good density and a much better result compared to taking those hairs and spreading them across the scalp. It also happens that a certain area has started to thin and the scalp peeks through, but it's just not really safe to implant more hairs yet. Distribution of the grafts or hairs is always finalized on the surgery day, but your doctor should be ready to discuss any options with you. So don't be afraid to ask questions and get as much information about your procedure as possible. Do you have any questions that were left unanswered? Let me know in the comments and I'll try my best to answer them. And if you enjoyed this video, subscribe to our channel. We post new videos every week, so you can take a look at success stories and learn more about hair restoration methods that can help you overcome hair loss once and for all. Thanks for watching.